Hi friends, good evening and welcome to my channel. Friends, in this video we can see another set of questions for exam preparation. We will see the question one by one. The first question, which is the most commonest site of intestinal obstruction, and the options are option A duodenum, option B ileum, option C colon, option D all of this. Our question is, which is the most commonest site of intestinal obstruction? So we all know the small intestine is the commonest area of intestinal obstruction. Small intestine. Among the small intestine, ileum is the most commonest part of intestinal obstruction. Among this option, ileum. If it is small intestine, in the option it is there means it is the most commonest area. Here ileum is there, so ileum is the most commonest part of intestinal obstruction. Okay, option B is the correct answer. Second question, treadmill test or stress test is used to detect. Options are option A myocardial infarction, option B congestive heart failure, option C pulmonary embolism, option D stenosis. Our question is treadmill test or stress test is used to detect. Option A myocardial infarction is the correct answer. That is, the treadmill test is used to diagnose coronary ischemia or myocardial infarction and exercise-induced arrhythmia. Here, myocardial infarction is there, so that is the correct answer. It is used to diagnose coronary ischemia or myocardial infarction and exercise-induced arrhythmia. How the test is performed, we will see. The test involves walking in a place on a treadmill while monitoring the electrical activity of the heart. Throughout the test, the speed is increased. Slowly the speed is increased and find out the exercise tolerance. That's the way to find out the treadmill test or stress test to detect the cardiac problems. Third question. Brunner's glands are present in which part of small intestine? Options are option A duodenum, option B jejunum, option C ileum, option D all of this. Our question is Brunner's gland present in which part of the small intestine? That is the question. So here Brunner's glands are mucus secreting glands found in the mucosa of duodenum. It is a mucus producing gland present in the mucosa of duodenum. So option A duodenum is the correct answer. Brunner's glands are present in the duodenum of small intestine. Fourth question. Pairs patches are found in the following part of gastrointestinal tract. Options are option A gastric mucosa, option B mucosa of duodenum, option C mucosa of ileum, option D colon. Our question is pairs patches found in the which part of gastrointestinal tract? That is the question. Here pairs patches are the lymphatic follicles present in the ileum. So this is a lymphatic follicles present in the ileum. So answer option C mucosa of ileum. This lymphatic tissue have the ability to neutralize ingested toxins. Okay, so the Peyer's patches present in the mucosa of ileum. Option C is the correct answer. The question, headquarters of the International Council of Nurses located in? Options are option A Germany, option B Switzerland, option C London, option D Italy. Our question is the headquarters of ICN is option B Switzerland is the correct answer. That is Geneva in Switzerland. Okay, that is the correct answer. Option B is the correct answer. The ICN was established in 1899. It is also an important question. ICN was established in 1899. It was the first international organization for healthcare professional. Okay. Sixth question, the best time for IUD insertion from which day of menstrual cycle? And options are option A 1 to 2 days, option B 3 to 7 days, option C 5 to 9 days, option D within 2 days. Question is, which is the best time for IUD insertion during menstrual cycle? That is the question. So answer is 3 to 7 days of menstrual cycle. That is the correct answer. The best time for IUD insertion is from 3 to 7 day of menstrual cycle, and the best time for IUD removal is first few days, that is 1 to 3 days of menstrual cycle. That is also important point. IUD removal, that is first few days, that is 1 to 3 days of menstrual cycle. Seventh question, the epithelial tissue which lines the urinary bladder is. Options are option A squamous epithelium, option B transitional epithelium, option C stratified epithelium, option D columnar epithelium. Our question is which type of epithelial tissue which lines the urinary bladder. That is the question. So answer is option B transitional epithelium is the correct answer. Ureter and urinary bladder is lined by transitional epithelium. Ureter and urinary bladder. So the various epithelial lining of various organ is an important area. That is squamous epithelium is there, stratified epithelium is there, columnar epithelium is there. All are important areas. Here our question answer. Option B is the correct answer. Eighth question, in following which cartilage act as a lead? Options are option A cricoid cartilage, option B thyroid cartilage, option C arytenoid cartilage, and option D epiglottis. Our question is which cartilage act as a lead? Correct answer is option D epiglottis is the correct answer. The epiglottis cartilage acts as a lid because it closes up the larynx during swallowing of food. That is, this acts as a lid during the time of swallowing and during the passage of air. Okay, so it acts as a lid and it closes up the larynx during swallowing of food. Okay, option D epiglottis is the correct answer. Ninth question, opening of the auditory tube is found in. Question and options are option A nasopharynx, option B oropharynx, option C laryngopharynx, option D esophagus. Question is the opening of auditory tube is found in. Answer is option A nasopharynx. In the opening of the auditory tube is found in the nasopharynx. And the next question, 10th question, the space between the vocal cord is known as. Options are option A epiglottis, option B glottis, option C Adam's apple, option D vermix. So question is the space between the vocal cord is known as glottis. Okay, option B is the correct answer.